The Birdie Board podcast is brought to you by the Birdie Board app, the easiest way to track matches, scores, and handicaps with friends. Now, here's your host, Corey, with another episode of the Birdie Board podcast.
All right, welcome back to the Birdie Board podcast. This is episode 12, and that's pretty exciting. So I've been doing a lot of winter-based golf episodes to try to just help people continue their golf training through the off season. A lot of us, and especially in the Northeast now, aren't playing much golf, so it's a perfect time to really gain understanding on the different parts of golf. So with that, I've brought in Mike Carnuccio. He is he has his doctorate of physical therapy. He's going to talk about today just the golf and spine. So welcome, Mike. I know the first thing you have on the agenda is just talking about the mechanics of the spine. Do you want to just roll right into it?
Of course. Yeah, let's get into it. First off, it's a pleasure to be here. Thanks for having me on. I think initially, I'm a big imagery guy, right? So I think it's good for everyone to imagine. First off, your spine is one structure, right? So our spine is the center of our body, and ultimately what it does is it protects the spinal cord, which is what connects our brain to our extremities and allows us to use our extremities, right? So it's a beautiful, beautiful thing. Ultimately, the spine, we have 24 vertebrae, which are bones. We kind of look like a dinosaur if you look at a skeleton. And so a portion of those make up the neck, 7 of them make up the neck, 12 make up what are called the thoracic spine in the middle, and 5 make up the low back, or what we call the lumbar spine, right? And so the fascinating part with the spine is and what I'd like to focus on today really are the discs. So a lot of people have heard of discs. A lot of people say, oh, I have a bulge disc, or they've heard of a bulge disc. And the discs are they're often the problem in our spines, but they're also the reason that our spines can do what they do.
Are the discs like bone too?
Good question. So no. There's a couple analogies that we'll use. When I was in physical therapy school, they used the analogy of a jelly donut.
Okay.
And I'm not a huge fan because a jelly donut is so fragile. It makes people think their discs are just gonna squirt out jelly, and which would be a herniated disc. And I think that I don't like that analogy. So the two that I'll use is one would be I actually just thought of this myself. It's funny, I threw it at Gemini just to see what Gemini thought, and Gemini thought it was a really good analogy. So a leathery hockey puck, because they're disc shaped, right, kind of like a hockey puck, and their material is kind of like leather, or a mix of leather and almost like metals. It would be like if metals were woven throughout leather.
So pretty durable then.
Very durable, yeah. But flexible at the same time because they have a jelly-like inside, and that flexibility is what allows us to bend forward, bend back, side bend, rotate. We have it's so many planes of motion, which is what allows us to swing a golf club. Right? You can swing a club because you can side bend, rotate, all of these different things. At the end of the day, the primary motion is rotation. And so the flexibility, durability, that combo is huge for the discs, and allowing us to do those things. The other analogy would be like a tire. It'd be like if you had a tire that's kind of like rubbery, but has still like metal within it. And I think it's interesting to note they're doing for the last 10 years a lot of disc replacement surgeries. And so they do these for a lot of athletes. And the material they use is a combination of a fiber material and it's almost like a metal. It's like a fiber and a metal woven throughout that creates a disc.
Are actual discs, does it actually have metal in it? Not literal, but like iron and stuff like that, or is that just more analogous?
Yeah, the term they would use is fibrous. It's like a fibrous tissue, but it's not. No, because our body doesn't generate metal. It's not possible to generate metal, right? Metal has to be put in.
I don't think I literally meant metal. I meant more so made up of like minerals and irons and things like that.
Yes. No. So yes. Yeah. You would be spot on with that. And the reason they use the metals in the disc replacement is the worst thing that could happen is that a disc collapses or gives out, because then you're losing the protection of the spinal cord itself. And now you have the chance for major issues and, in worst case, paralysis. And now you can't, now you can't use your extremities, and you lose all function. So protection of the spine, durability of the spine has been the number one goal when it comes to surgeries. And then they kind of focus on, all right, can we still move and do our general activities?
Yeah. Okay, so just to catch everyone up to speed, I should have started with this outline a little bit, but we're gonna dive. We just finished kind of diving deep into the mechanics and more of the technical term, and we're gonna slowly back it off from there. Talk about common injuries, then take it
Yep.
back to even closer with like how does this relate to golf, and then we'll finish up with some examples. So we just finished up with the actual mechanics, more of the technical understanding. Now we're going to move into some of the common injuries that could happen with your
Yep.
spine.
Yep. So yeah, I mean, the one that most people should be generally aware of is a disc bulge, right? And so, I wish so. Like in our office, I have a skeleton, and on the skeleton, they actually show, you can see the disc coming down the spine, and they show an analogy of the disc bulging. And anyone could look this up if you went to YouTube and just typed in disc bulge, and you could say something like cartoon replica of this happening or something like that. 3D replica, something like that. It'll show you, and it's pretty cool. So the physical disc literally protrudes, right? So it'll literally shift and protrude, kind of like if I were to take a donut and start to push, and that donut will start to give and move in a direction, if that makes sense.
Mm-hmm.
So disc bulge would be the most common thing that happens. A herniation is when the jelly on the inside, so the inside we call the nucleus pulposus, the outside, the outer layer is we call the annulus fibrosus. When that pulposus pokes through and squirts literally liquid onto your nerve root, which would give you shooting pain down your
That
leg.
sounds terrible.
This is people where people will get sciatica. They use the term that sciatica gets used a lot. We call it radiculopathy. It's when you get these nerve symptoms that shoot, and it could come from your neck and shoot down your arm. It could come from your low back and shoot down your leg.
That sounds awful.
And so, yeah, disc bulge, disc herniation, and then
So
kind
is
of last.
bulge, are they opposite? Is bulge coming out and herniation more going in, or is it not exactly?
No, so it's the same.
Okay.
Good thing to understand, and that's a good question. Is like a high majority of discs bulge towards the back posteriorly. So if I'm facing this way, the bulges go that way, which guess what? That's where the spine is, right? The spinal cord sits kind of in the back, and the nerve roots come out from the back and then innervate down the leg. Well, when the bulges go back, that's where they go towards the nerve root. So our spinal cord comes down.
So it's bulging like, is it correct to say inward? Like it's almost bulging inward, or just shifting, or
it's a good question. I say it bulges backwards just because that is literally the direction it goes. If I'm standing here, the disc bulges that way, which is towards where the nerve root is.
I see.
And again, anyone right now, if you could look up a replica of a spine, you would see what I'm talking about, that the disc has to go backwards to then pinch or adhere onto a nerve root and give you those radicular symptoms.
So that's in the case of a bulge, right?
That's in the case of a bulge. So a bulge can get bad enough that the space for the nerve root, right? Here's my space, and a nerve root is coming out from the spinal cord, and it comes through the space. We call that the foraminal canal. And it goes down, and then it goes and innervates the muscles. That's how we have sensation. It's how we activate muscles and contract muscles. Well, when the bulge comes in, this is what it does. It closes down that space. So now my space is that big.
So it's like squeezing like a straw tight, and it's not.
Yes. And so the analogy I'll use then, it's not that the bulge often hits the nerve root, it's that it makes the space small enough, and inflammation fills that space, puts pressure on the nerve root. And it's kind of like a water bottle. If I took a water bottle and I kept filling it with water and kept filling it, the pressure within that water bottle would increase to the point where whatever's inside of there will have an increased pressure on it. That's what happens to the nerve root. And so you have to reduce inflammation to then get pressure off the nerve root. And that's primarily what we do in physical therapy. I often don't physically change where the disc is, but I help to reduce compression of the disc, and I help to reduce inflammation on the nerve root, and ultimately to reduce pain and improve function for people, if that makes sense.
Yeah, definitely does. So is there anything
The
else
last
you
thing
want
I
to?
was going to say is,
Yeah.
yeah, you could. The last injury would be you could actually compress a nerve root with a certain action, and we'll get into that specifically with Sahith Theegala, who was compensating for an oblique injury, and when he was going and swinging over and over and over again, he was lifting his shoulder early because of the pain from his oblique, and he ended up tweaking his neck aggressively multiple times, and I think he literally compressed his nerve root a couple times, and that was giving him shooting pain, and it took him out of tournaments for a while there.
Wow.
So
Yeah.
that would be
So
the last kind of mechanism.
so we have a deeper understanding. Well, you have a deeper understanding. We have the Cliff Note version of it.
Yes.
And we have you talked about three common injuries: the disc bulge, the
Yep.
herniation, and
And then
then
like a
pinching a
compressor.
nerve.
Yep.
So let's relate it now back to golf and how
Yep.
this kind of base understanding can kind of help us at least understand maybe some golf injuries or something like that.
Yeah. So, I mean, first off, you have to understand that in golf, right, we are rotating at pretty fast paces. I mean, some of these swing speeds have really gotten crazy, right? I mean, sometimes when we play on the golf sim, we're tracking our swing speed, and that's how we're getting distance. Well, there's only so much of a swing speed that we can control with our muscles. So, if anyone has watched Full Swing on Netflix, great show. They do a fantastic job. They'll always show the behind the scenes of these pro golfers training, and they're in the gym and they're doing a lot of rotational training, which they should be. They're going to train their oblique muscles. They're going to train the rectus abdominis. They're going to train the transverse abdominis, different muscle groups that are involved. Their hips are very involved as well, right? And so they're training these muscles to control motion. But when you get fast enough and you get strong enough, eventually the force is going to go through the spine and affect those discs. So, we see guys like Bryson DeChambeau. We have these guys who are, I mean, they're driving the ball 400 plus yards consistently, and it's leading to advantages on the course. And even their approach shots, right? I mean, DeChambeau is insane with how far he can hit his 9 iron, and a lot of this is coming from swing speed. If you ever watch DeChambeau in his YouTube channel, he like got together with Tim Tebow, and they
Yeah.
were like working on getting that swing speed up over a span of like 100 swings. Well, dude, I'm watching it. I'm like, your control is getting less and less and less and less. There is more and more and more force on your spine, and therefore higher chance to compress a nerve root, higher chance to compress a disc, aggravate, bulge a disc, worst case herniate a disc.
Yeah. So before we jump to specific examples, I want to stick on this injury for a little bit because um, these podcasts I'm doing during the winter is all about just like building your knowledge. So we've kind of talked about how these injuries can occur. What are some things that people could do to help prevent
Yes.
these, not only in the off season? So let's take it in two separate
Yep.
buckets. So
Yep.
what can they do this off season, say between today and
Yep.
March, depending on where you are
Yep.
in the country? And then what could they do when the season starts and they shift from like their off season training to
Yep.
how do I stay healthy during the season?
Yep. Great question. So, first off, my first word of advice would be make rotation a regular part of your training, right? So when you're in the gym, when you are training, I'm assuming everyone who's out there golfing is doing some form of training, or you should for your spine. Make
Even
rotation a
for
regular.
even for injury prevention, just to stay
Yeah,
healthy. Yeah.
yeah. So even just for injury prevention, right? So make rotation a regular part of your training. What are examples? There's a million ways to do it. You can take a cable, that was common one people do, or you can take bands and you can do a rotation punch, right? You can do what we call a power off press, which is where you basically do a step out, a punch, and a step back in, and you do that over and over and over again. And you train your oblique muscles to control those movements.
So
Okay.
how's that helping your spine?
Yes, good question. So remember, the way I just explained it with swinging a golf club is when you go to swing a club, the more engaged your muscles are as you go and rotate and do different things, the more control that the muscles take on, the more force the muscle takes, the less force that the spine itself takes. Does
That
that make
makes
sense?
sense. Yeah, that
So
makes total sense.
so we want the forces to be taken through the muscles and less through the spine itself. However, I would say part two is you need your spine. This is where mobility comes in. So we talk about aspects of we want to have strength and motor control of the right muscle groups, we also want to have good mobility through your spine. If you can only rotate a certain degree, 45 degrees to the left, well, when you go to swing, you're going to hit that end range and blow through it. And then most of that force goes through the spine itself. So
Instead of
even just
your muscles and
general
stuff. Yeah.
rotational mobility, what's a classic one? Lay on the ground and do what we call an open book. Okay. Lie on your side, rotate your upper body and get a good deep stretch into rotation, and then come back and do that again. Now, Corey, I would break training up into two parts.
Okay.
One is the training that you do just in general, right? Just day to day. Then there's the actual warm up,
Yeah.
right? So like people are always like, and we struggle with this in physical therapy, is like I'll give people home exercises, but sometimes I'm giving them, for older adults, I give them a warm up to do in bed before they get out of bed, because getting out of bed is a problem for them, because that's where their pain kicks in. So I say you need to warm up in bed before you get out of bed. Well, it's the same
Yeah.
for golf, right? You can't just show up and just start cranking your driver. I think some form of a routine is really, really important in injury prevention. So whether that routine involves getting on the ground on your side and doing physical open books to start to warm up the spine, or as simple as I'm going to start with my smallest club, I'm going to start with a sand wedge, and I'm going to do some nice, easy swings, and I'm going to just rotate, and I'm going to do that repetitively, and then I'm going to
Just
work
warm
up
up a little bit.
slowly. Yeah, so you could really simplify it to kind of like if you were going to go on a jog, right? You can warm up your jog by just lightly jogging at first. You don't go full sprint, right?
Yeah.
With golf, you can do the same. You can go out, start with the dumb thing people do is they go out and they go to the driving range and they grab their driver first, and they're crushing the ball, and then they wonder why their low back hurts. And it's like, well, you didn't warm up your spine at all, and you get away with it in your teens and 20s. Hit your 30s and things change quickly. So I think it is important to have a regular routine of training your oblique muscles, rotational strengthening of those muscles to take on the forces when you swing, and working on mobility as well.
So
And
would
then
you
I would say the
agree?
warm up routine is very important.
So would you agree that like during this off season, the main focus is to strengthen your obliques and the rotational muscles, and then the important takeaway once the season starts is obviously if they can keep that up, continue. It doesn't hurt anything, but to make sure
Yes.
to have some sort of routine to warm up, even if it's 10,
Yep.
15 minutes, just get something to activate those muscles so that you're not
Yes.
causing injury with yourself.
Yep. Yep.
Yeah.
And that would be the two steps I would give in the off season. Highlight a lot of training. When you hit golf season, highlight that warm up and take a lot of what you did in the training and give yourself that warm up routine. That's a simple plan. I think everyone should put into effect. It would be very beneficial.
Yeah.
If there were one other muscle group I would include in addition to those oblique muscles, those rotational, it would be the hips. And
Okay.
so our hip muscles, the main one that everyone's extremely weak in, that we play a pretty big role in. Now, the question too is what's happening in your hips? Well, you rotate your hips. So you want to have good internal rotation and external rotation mobility at both of your hip joints, because this is a common rule in the body. When you don't have good motion at one body part, at one joint, okay, so let's say your hip, you will compensate at the closest joint to get that motion. So here's the classic example. I go to rotate to start my swing. When I go to rotate onto my back leg, I'm internally rotating on my right hip. If I don't have enough internal rotation at my right hip, where am I going to compensate? At my spine. My spine has to compensate for that lack of motion. I will then extra rotate up my spine, putting undue stress through the spine, and therefore putting the discs, because I really think they are what at risk of a bulge. Right.
I'm glad you mentioned that, because I wouldn't want someone listening to this to just think like, oh, the only thing I need to do is just strengthen my rotation. I'm going to be a PGA golfer. Because then, like you said, like it could go the opposite way too. Now your spine is all strong, your rotation from your hips up is all really strong, but now you're putting extra strain on your hips, and now you're having a different problem, and you're like Mike and Corey, what the heck? Like, I followed the plan. So it's important to have a nice balance, but also really touching the key muscles in a golf swing, all of them, not just one.
So that's where, again, I would say if someone was like, okay, give me, boom, quick three, what should I prioritize when I'm training in preparation? It would be the spinal rotation, right? And that includes just mobility and activation of those oblique muscles. And then it would be hip rotational mobility, right? That's internal and external, and strength of those muscles. We have muscles that do those activities as well.
Mhm.
That would be the primary focus of what I would tell people to do.
Awesome. So what are some examples that you've seen among PGA golfers with these
Yeah.
different
So
things?
there were a few I wanted to bring up, and the one I actually like the most that I
Mhm.
remember watching on TV when it happened was Will Zalatoris. So everyone remembers, right? Short, blonde-haired guy, real skinny, had a very powerful swing. He's still playing, right? He's still on tour, but he's not the same. Let's be real. He in 1 year, he was, I mean, he was second place at two of the majors, and he was top 10 at the other two. So he was.
At points, he looked like he was just going to be the next big name.
Yes, yes. And a lot of guys do that, right? They spring up. But I really do think he was impacted by his injury. So, August 2022, we're going back 3 years now, at the BMW Championship, he later had an MRI that confirmed two bulge discs. And I knew, I was watching on TV. At that time, I am treating as a physical therapist. I watch him swing. I see what happens. I go, he has bulge discs, 100%. And the irony was he had a guy there with him. And I don't know who the guy was. Might have been a buddy. And that guy's like, oh, and the guy did a manipulation on him. And I was literally covering my eyes, like, no, bro. Like, because when you do a manipulation on the side of the bulge, you just compress the disc more. So the moment the guy did the manip, I was like, dude, he's gonna
He's
be
done.
terrible. And he goes to walk and literally can't move at that point. Like it was already flared and it got significantly worse. I would have said, yo, take an anti-inflammatory and just do some general mobility, and you're probably done because your swing is too aggressive.
Yeah.
So I did look up, and he ended up trying to rehab it himself without getting anything done, and he was unable to. He actually, I think, when you have a strong enough swing, a powerful enough swing, it's just too much on those discs. And so what he had was called a microdiscectomy. And
Mhm.
so if that disc bulges towards the back, they go in and they shave down a portion of that disc to open up space for
That sounds
that. Open
terrible.
up. It's terrible. I mean,
Yeah.
any surgery is rough on the spine. I do not advise ever getting surgery on your spine. However, if there was a surgery that is not very invasive, it's this one. It's shaving down the disc. It's way better than a fusion, which I won't even get into. But he had that done and then was able to rehab and slowly get back. But here's the reality, Corey. Will now people this is the issue with people how they view injury. They think, oh, he had the surgery, he's good. That's not how it works, right? There's a toll a surgery takes on you. So now his disc, which bulge had a portion cut off of it, he only has a portion of the disc left. Now he still has a lot of it. But if he bulges that disc again, has to get another discectomy on it. That space for that disc is not good anymore because a lot of that jelly might have herniated out, and so the disc is losing a lot of height, and so that canal there for that nerve root is getting less and less
That
and less
sounds
and less.
awful. Yeah.
Zalatoris could be looking at a disc replacement at some point in the future. Hopefully, he doesn't do a fusion because they're a nightmare in most cases. But he's not. His career is I think heavily impacted by the injury, and I really think he's going to deal with spinal issues the rest of his life. So not to
Can
put it.
you touch real quick, like in
Yeah,
1 minute, what a fusion is?
yeah. So fusions are the surgery right now that shouldn't exist anymore, but they do. They basically take the disc out and they put bone in. So they replace it with bone.
Okay.
This is still done a lot. I see a lot of patients with it. Outcomes are completely mixed. About a third of people get better, a third of people stay the same, and a third of people get worse. The people who get worse, it's bad. It's really bad. The people who get better end up having issues down the road. And here's why. When you replace a disc with bone, that segment doesn't move anymore. So that segment is now
Mm,
all bone. And so when you go to rotate and bend and side bend, you compensate at the segments above and below where the other discs are. So now they take on a lot of the forces.
yeah.
You end up needing to fuse those segments. So most people I see, they'll start by fusing the lower lumbar spine because that's where most of our issues tend to be L5, S1, L4, L5. But eventually they have to work their way up L3, L4, L2,
Next
L3.
thing you know, they
I
can't
see.
even rotate.
Then they just fuse the whole lumbar spine. In fact, I've had patients where they go see a neurosurgeon, and neurosurgeon was like, "Look, I can fuse one segment or two. You'll be back in a year or two. Let me just fuse the whole thing." And they
It
fuse
seems
the
like a propagating problem. Like once you get one, it's
yes,
just going to cause the rest to start to fail.
yes,
Yeah.
yep. So
Interesting.
I highly encourage people, don't go get a fusion. I really think that the disc replacements are promising. We can get into it if you want to, but Tiger Woods just got one. That's his most
Hmm.
recent surgery with an actual replacement. I highly encourage people of focusing on. I said this earlier. The problem in most cases is that the space is small and inflammation is filling it. If we can reduce inflammation, we
Hmm.
can then improve your ability to keep up with a lot of activities and not have to get the surgery. And we have a lot of things within our control that impact inflammation, stress, diet, sleep,
Yeah.
hydration. So these are the things I start to get into with people to address the inflammation in addition to the therapy, the exercise, the mobility, to try to really hit that inflammation, get it down, and get them back to doing what they want to do without needing to get surgery.
So do you have any closing thoughts you want to leave us with?
Yeah. So, I mean, I would say for those of you who are dealing with low back pain in relation to specifically golf, I mean, you might be like, look, when I play golf, my back hurts. It feels like I can't win. It feels like I'm gonna have to get surgery if I want to continue to play golf. My personal story is that I've dealt with my own back pain and my own disc bulge. L4, L5, left side. At one point, this was years ago, I had shooting pain down my left leg. Well, I've rehabbed it myself. And so my encouragement would be patience is key. You have to give yourself time. Discs have very poor blood supply and they take a long time to heal. And so, really, if you're dealing with low back pain and injury, we give that disc time. Focus on ways to reduce inflammation. So focus on your diet, specifically sugar and processed foods, and trying to reduce those consumption of those. Focusing on your stress and getting good levels of sleep. And you're going to see over time your inflammation is going to come down, and your tolerance for rotation and swinging the club is going to get better. And then, of course, we already talked about it. Make your warm up and make your training a key part of what you do, and you're going to get back out on the course. And I think you'll get back to swinging pain free eventually. It's going to take time, but
Yeah.
give it time.
I will say I think I'm sure this is an aspect of it too. One of the best improvements I made to my own golf game this year was actually watching you swing. And it's not
Mm,
because you're a good golfer at all. So I don't want
no.
you to, get in your head at all. But
I'm
your
I'm actually
post
like very average golf. I'm not that good.
but your posture was so
Sure.
good. And
Yeah.
I noticed it mostly in the straightness of your back.
Yeah.
And I switched to that sort of posture, just not as hunched over. And it's not like I was leaning over the ball, but I was a
Sure.
lot more relaxed with it. What it got
Right.
me into is like an athletic stance. And I was
Yeah.
rotating so much more clean and so much more consistent from that.
Yes.
And I honestly, I don't typically have any back problems or anything, but like I just didn't feel sore ever in my back.
Yeah.
Like just having the proper stance helped too.
Yep.
So, anyways, hopefully everyone enjoyed this episode of the Birdie Board podcast. There was definitely some technical pieces, but I love that background, especially during this winter golf. You guys can take it and Google more and
Yep.
ChatGPT, Gemini, whatever your AI tool is. But Mike, thanks
Come on.
for joining us. And that's it
No
for
problem at
this
all.
episode of the Birdie Board podcast.
Oh yeah, baby. Get out on the
All right.
Sims, boys. Get out on the Sims.
Thanks for tuning in to the Birdie Board podcast. If you enjoyed it, subscribe and share it with a friend who loves golf as much as you do. And before your next round, grab the Birdie Board app, free on the Apple App Store and Google Play Store, and let it handle the scoring while you enjoy the game.